Stop letting stress control your skin. You're not doomed to breakouts, premature wrinkles, or flare-ups every time life gets intense. I used to think stress was just an inevitable part of life, but after spending 11 years in clinical practice, I can confidently say that the truth is you can take control and protect your skin. This video will show you the surprising ways stress impacts your skin and, more importantly, what you can do about it. Hi everyone, I'm Dr. Mamina Torregano, a triple board certified dermatologist, internist, and dermatopathologist. Welcome back to my channel. Today we're diving into a topic that affects so many of us, the connection between stress and our skin. We'll explore how stress manifests on your skin and, most importantly, evidence-based strategies to combat the effects. My goal is to empower you with knowledge and practical tips to achieve healthier, more resilient skin no matter what life throws your way. So first, let's talk about the stress-skin connection. It's really not just in your head. Stress has a very real and measurable impact on your skin. When you're stressed, your body releases stress hormones like cortisol. Cortisol is a key player in something called the hypothalamic pituitary adrenal axis, the HPA axis. This is your body's central stress response system. So the surge in cortisol can trigger a cascade of reactions in your skin. One of the main effects is increased inflammation. So stress can activate inflammatory pathways in the skin, leading to or exacerbating various skin conditions like acne, psoriasis, eczema, and hair loss. And stress can also impair your skin's barrier function. So this barrier is crucial for retaining moisture and protecting against irritants, and stress can weaken it. Also, have you ever noticed how your skin gets oilier when you're stressed? Cortisol can stimulate oil production, which can contribute to breakouts along with increased inflammation. One of my favorite stories about this is as dermatologists from my residency, we all have to go to Tampa to take our board exams, and it's probably the hardest exam we've ever taken in our entire life. It was funny because we were so stressed out about it. And we all had like acne on our foreheads. We were all derm residents, okay? So picture all of us with acne on our heads. Stress definitely can do some damage to the skin. All right, so let's talk about some specific skin issues that are often worsened or even triggered by stress. Acne is probably one of the most common ones. Stress-related acne can show up in all forms, but it often flares as inflammatory lesions. So they're deep, red, painful pimples. And increased cortisol, like I said, can increase oil production. So you get more inflammation and a disrupted skin barrier. And like I mentioned earlier, when you have increased cortisol, you have more oil production. You have more inflammation in your skin. You also have a disrupted skin barrier. So all of these is like the perfect storm for having breakouts. Eczema and dermatitis, which are just rashes in general, are highly sensitive to stress. So stress can trigger flare-ups, leading to itching, redness, and a compromised skin barrier. And I've had patients whose eczema flares almost exclusively occur during periods of high stress. And it's definitely one of the clearest examples of the mind-skin connection. Stress also plays a role in psoriasis, seborrheic dermatitis, perioral dermatitis, rosacea, all of which can flare when the body's stress response is activated. There's also hives, also known as urticaria, which can appear suddenly under emotional pressure or anxiety. I feel like a lot of people have seen this. There's also the realm of the hair and the scalp. We often see a lot of stress-related issues. There's telogen effluvium. So this is a type of hair shedding that usually shows up a few months after a major stressful event. We see this often after things like having childbirth, having surgery, losing a loved one, like a really bad breakup, being started on a harsh medication like chemo, drastic weight loss. These are all stressors on the body. Major illness, COVID, we see a lot of hair loss from that. And it almost like sends your system to a shock. It sends a signal to your hair like, hey, let's just go into the resting phase. The resting phase lasts about 3 to 5 months, and then after that, you notice hair shedding. And then there's also alopecia areata, which are like these bald patches that you'll see throughout the scalp. This is an autoimmune form of hair loss. It can manifest also as just like full-on baldness, but that's not as common. But this definitely has been shown to be associated with stress, whether it's a trigger or just something that can worsen the condition. Interestingly, there was a study in JAMA Dermatology that showed that certain essential oils can help with hair regrowth in alopecia areata. Then there's also behavioral patterns that we see as a result of stress. So when people are stressed out, oftentimes it'll result in like picking behavior. So people like pull out their hair, that's called trichotillomania, or like pulling at your skin, dermatotillomania. And skin picking is a huge thing in people with like a lot of anxiety, people who like to pick their acne bumps. It's a thing. This is like somebody's way of just sort of manifesting their stress or manifesting their anxiety, and picking almost kind of like soothes it for them. Some patients experience itching without out a visible rash. This is often called psychogenic pruritus, which can be incredibly distressing. Can you imagine? Like, you're so itchy, but there's like nothing to show for it. And it's really hard to manage without really addressing the underlying cause, which oftentimes is a form of stress. There are other skin issues that we could see in the setting of stress. So we can see delayed wound healing. We can see increased skin sensitivity. We can see flare-ups of viral conditions like cold sores, herpes, shingles during these high stress periods. Basically anything that involves inflammation, our immune system, these can all be exacerbated by stress. Stress also plays a significant role in how our skin ages, both in how it looks and how it functions. So when you're under chronic stress, your body produces more cortisol, which can break down collagen and elastin. These are the proteins that keep our skin firm, smooth, and elastic. So over time, this leads to wrinkles, fine lines, sagging, especially if the stress is paired with other factors like poor sleep, poor diet, those types of things. And if you need a visual example of how stress affects aging, just think about how US presidents look after their 4-year term. You can see stress written all over their faces, literally. Like, they just look older, their hair is more gray. It's interesting and just a visual representation of how stress affects your skin. Stress can also impair your skin's barrier function, like I mentioned, so it makes it harder to retain moisture. You're more prone to dryness and dullness, so that makes you look older. Stress also increases something called oxidative stress. So this triggers something called free radical damage, which is a major contributor to premature aging. And here's something deeper. Chronic stress can actually shorten your telomeres. So these are the protective caps at the ends of like your chromosomes, your DNA, that naturally get shorter as we age. So the shorter the telomeres or the telomeres, the faster your cells, including your skin cells, can age. So managing stress isn't just about feeling better or avoiding breakouts. It's a science-backed way to support your long-term skin health and slow visible signs of aging. Watch my video here on skin aging where I go into the depth of skin aging. Okay, so now let's get to the good stuff. What can you actually do to manage stress and in turn protect your skin? Mindfulness and meditation are powerful tools. They can help regulate your nervous system, they reduce cortisol levels and bring you back to the present moment, something that your skin absolutely can benefit from. Even just 5 to 10 minutes a day can make a difference. And of course, regular movement, exercise, this is another major player. It boosts endorphins, it improves your circulation, it reduces systemic inflammation even. You want to aim at least 30 minutes of moderate activity most days if you can. Even things like walking, yoga, dancing, whatever makes you feel good, that's an activity, will help. And then of course, sleep is a non-negotiable. When you're sleep deprived, your body stays in a state of low-grade stress. You want to aim for 7 to 9 hours of quality sleep. You want to protect your bedtime with relaxing wind down routine, dim your lights, no screens, and maybe some breathing exercises. And speaking of which, deep breathing is one of the quickest ways to calm your stress response. My favorite technique is the 4-7-8 technique. You inhale for 4 counts, hold for 7, then you exhale for 8. And you can literally feel your body shift to this like more relaxation mode. I have been doing it for literally 25 years and it's been so helpful. I also love practicing gratitude. There is science that shows that thinking of things that you're grateful for is so helpful for your body. You can just write down like 3 things that you're thankful for each day, and that can help rewire your brain towards a calmer, more positive outlook. And then spending time with loved ones is one of the most underrated forms of stress relief. Laughter, connection, feeling supported can actually lower your cortisol levels. Other tools you might want to consider: spend time in nature. Even 15 minutes can help reduce stress hormones. Look into creative outlets like journaling, art, music. There's so much. I talked about dancing earlier. That like kills multiple birds with one stone. It's like movement and creative. I'm personally a huge fan of body work, things like massage and acupuncture. And then just simply knowing how to set boundaries, like knowing how to say no to things that drain you. I'm kind of bad at this, so it's a work in progress. Bottom line, there is no one size fits all, but small, consistent, stress relieving habits do add up. So not just for your mind, but for your skin too. So let's talk about a skincare routine for somebody who deals with stress. What should you do differently? So by now you've seen that stress can show up on the skin in so many different ways. There's acne, eczema, increased sensitivity, increased flare-ups of conditions like psoriasis, rosacea. So there's no one size fits all routine for somebody with stressed skin. But what I can offer are some general skincare principles that can support your skin when your body is under stress. So when it comes to cleansers, you want to keep it gentle, avoid harsh scrubs, stripping cleansers, because these can obviously make things worse. We already said that your barrier is delicate, especially in times of stress. And when it comes to cleansers, I usually recommend staying fragrance-free, using non-foaming cleansers with calming ingredients, whether it's aloe, glycerin, those types of things. You also want to support your skin barrier. Stress, like I said, compromises the barrier, leading to water loss and increased sensitivity. So you want to look for moisturizers with things like ceramides, hyaluronic acid, squalane. These can help replenish and lock in moisture. And then you want to to reduce inflammation. So skincare ingredients like niacinamide are great for calming redness and irritation across many skin types. It's one of my go-to ingredients to have in a moisturizer for people who deal with acne and rosacea. Also be sure to not introduce too many actives during a stressful flare, especially if your skin's already reactive. So think nourish and protect, not treat aggressively. So a stressful time may not be the best time to introduce like a new exfoliating agent or a stronger retinoid. And of course, depending on your medical condition, you may need prescription meds that calm down inflammation or to calm down acne, you know, whatever is going on. And of course, healthy skin isn't just about what you apply topically. Managing stress, getting enough sleep, eating a balanced diet, and creating moments of calm can all reflect back on your skin. If you want more conversations like this, especially where we talk about skin, women's health through science and real life experiences, check out our podcast, Skin Deep MDs. I co-host it with my friends, Dr. Jenny Liu and Dr. Lindsay Zabritsky. We all get into it, like hormones, treatments, trends, and everything in between. So that's a whole nother thing. So in addition to stress management and skincare, there are certain lifestyle changes that can make a big difference. I mentioned some of them earlier. A balanced diet rich in antioxidants can help lower inflammation. Focus on fruits, veggies, omega-3 fatty acids. You obviously also want to identify and limit your personal stress triggers as much as possible. Easier said than done, but do not text your ex back. Okay. And sometimes, despite our best efforts, professional help is needed. If you're struggling with persistent skin issues, consult a dermatologist. They can provide personalized treatment options, which may include prescription medications or in-office procedures. And counseling is always a helpful thing. A therapist, I feel like everyone should have a therapist. If you don't have a therapist, you should look into it because they just make everything better. Managing stress and its effects on the skin is a journey. It's not a quick fix. So don't fall for products that promise instant results. Consistency and a holistic approach are key. And remember, you're not alone. Many people experience the impact of stress on their skin. I see it all the time in my office. I hope this video helped connect some dots between stress and skin, whether you're dealing with breakouts, increased sensitivity, flare-ups. There's a lot we can't control, but how we support our skin and manage stress does make a difference. If you've dealt with stress-related skin issues, I'd love to hear what has helped you or what you're still trying to figure out. Drop a comment below. I always love reading what you have to share. And if this was helpful, feel free to give it a like, subscribe for more skin insights grounded in science, real life experience, and a more holistic approach. Thank you so much for being here, and I will see you in the next one.